Good morning students. Today we will discuss about the topic anatomy of femur. Now let's start about the introductory portion. The word femur is derived from the Latin word os femoris, which means thigh bone. It is shown over here as well as over here. It is located in the thigh region, so it is also called as thigh bone. This is the longest, strongest and the heaviest bone in the human body. Its function is to transmit the weight of the upper body to the tibia. Just like I told you, the hip bone transmits its weight to the femur. The femur transmits the weight of the entire body to the tibia. Just like any other long bone, it has an upper end, a lower end and a shaft. Now let's discuss about the various parts of the femur. Firstly, we will start with the upper end. The upper end consists of the following parts: the head, the neck, lesser trochanter, greater trochanter and few more parts which are not shown in this diagram. I will be discussing it later. First, let's discuss about the head. The head is roughly spherical. It forms around 2/3 of a sphere. So you can see, if we will try to form a sphere over here, over the head of the femur occupies roughly 2/3 part of this imaginary sphere. This head articulates with the acetabular cavity or the acetabulum of the hip bone to form the hip joint. It contains a roughened pit which is situated just below and behind the center of the head. This is called as the fovea. See over here, this pit, okay, which is below and behind the center of the head. If I place the center of the head over here, so it is below and behind the center of the head, okay. So this pit, okay, which is encircled over here, this is called as the fovea. You can see over here the fovea is shown clearly. The yellow arrow is showing the pit which is called as the fovea. Through the fovea, a branch of the obturator artery enters and supplies to the head of the femur. This branch is called as the foveal branch of the obturator artery. The head is directed medially, upwards and slightly forward. See, it is directed medially and upwards and slightly forwards. After the head, we will discuss about the neck. The neck connects the head with the shaft. It is about 3 to 5 centimeters long. The neck forms an angle with the shaft which is about 125 degrees in the adults. See, this is the shaft and this is the neck. So the angle which is formed over here is roughly 125 degrees, right? Okay. Or in some persons or some individuals it can be about 120 degrees, okay. So there is a varied approximation, okay. So that this angle can vary from 120 to 135 degrees, right? And this is called as the angle of inclination. The neck has two borders and two surfaces. The two borders are upper and lower border. This one is the upper border and this one is the lower border. The upper border connects the head with the greater trochanter. See, this is the head and this is the greater trochanter. So the upper border connects, this is the upper border, it connects the head with the greater trochanter. Whereas the lower border connects the head with the lesser trochanter. See, this over here is the lesser trochanter, this is the head. So the lower border connects the head with the lesser trochanter. Other than the two borders, the neck of the femur also has two surfaces. First one is the anterior surface which faces anteriorly or in the front. Then there is a posterior surface which faces posteriorly or at the back. Next we will discuss about the greater trochanter, which is over here. The greater trochanter is a large quadrangular prominence which is located at the upper end. This is located exactly at the junction of the neck and the shaft. This is the neck and this entire portion is the shaft. So this is located right at the junction. Okay, this is the junction. Okay, this is right at the junction. So this is called as the greater trochanter. The greater trochanter has three surfaces. First one is the anterior surface, which is shown over here in blue highlight. You can see over here, this is the anterior surface of the greater trochanter. Next one is the lateral surface, which is shaded over here with green. This is the lateral surface of the greater trochanter. Next one is the medial surface. This lies at the posterior portion. Okay, the one which is highlighted over here with green. Okay, this is the medial surface of the greater trochanter. So it has three surfaces: anterior, medial and lateral. Now at the medial surface there is a deep but small fossa present, okay, which is called as trochanteric fossa. Okay, fine. It is present near the medial surface of the greater trochanter. Okay. Other than these three surfaces, there is also an apex, which is shown over here with red color. Okay, this is the apex of the greater trochanter. So there are three surfaces at the greater trochanter, and then there is an apex. Next we will discuss about the lesser trochanter, which is this. The lesser trochanter is a conical eminence present at the posterior-inferior part, okay, which is at the junction of the shaft and neck. Okay, so this is the neck, this is the shaft. Okay, this is present exactly at the junction. Okay, and exactly this is present at the posterior-inferior part. This is present posteriorly as well as inferiorly. It is inferior as compared to the greater trochanter. Now let's discuss about the intertrochanteric line. Like the word suggests, intertrochanteric means it is a line or ridge which is present between the two trochanters, the greater trochanter as well as the lesser trochanter. See, this is the greater trochanter and this is the lesser trochanter, and this is an oblique ridge which is present between them. Okay, this is present exactly at the junction of the neck and the shaft of the femur. A similar thickened ridge or crest is present at the posterior surface as well. This is called as intertrochanteric crest. This is also present between the greater trochanter and the lesser trochanter, but this is present at the posterior portion, and it is much thickened as compared to the intertrochanteric line. Now over the intertrochanteric crest there is a round small prominence which is present exactly in the middle. It is shaded over here in purple color. This is called as the quadrate tubercle. Now let's discuss about the gluteal tuberosity, which is over here. Now gluteal tuberosity is a broad area on the lateral part of upper 1/3 of the shaft. So if we'll consider the upper 1/3, if we'll divide the shaft into three portions, the upper 1/3 portion, exactly at the upper 1/3 portion to the lateral part, okay, there is a broad roughened area, okay, which is called as the gluteal tuberosity. Okay, now this forms the insertion point of the gluteus maximus muscle. This completes roughly all the parts of the upper end. Only one part is somewhat remaining, which is the fovea. Fovea is a roughened pit or depression which is situated just below and behind the head. So this portion over here is the fovea, and if I'll consider the center of the head, okay, it is placed just below and behind the center of the head. This particular portion, which is marked by the yellow colored arrow, will be called as the fovea. And through the fovea, a branch of the obturator artery enters into the head of the femur to give its blood supply. This branch of the obturator artery is called as the foveal branch of the obturator artery. Now let's discuss about the shaft. The shaft is the long middle portion of the bone. It is more or less cylindrical and narrow in the middle portion, and it is more expanded inferiorly and superiorly. like you can see in this diagram. The shaft is convex forwards and it is somewhat directed medially while it is present in its anatomical position. The complete shaft can be divided into an upper 1/3, okay, and then a middle 1/3 and then a lower 1/3. So it can be divided into three portions: an upper 1/3, a lower 1/3 and a middle 1/3. It has three borders and three surfaces. Let's discuss about the borders first. First border is the lateral border. Like the name suggests, it is placed laterally, and this border separates the anterior surface from the lateral surface. So over here in this portion is the anterior surface and this portion is the lateral surface. So the line which is marked over here is the lateral border. It is continuous from the greater trochanter to the lower end. Okay, so this is called as the lateral border. Next is the medial border. Like the name suggests, it is placed medially. This separates the anterior surface from the medial surface. The anterior surface is directed this way and the medial surface is directed this way. Okay, so this is a line which separates the anterior surface from the medial surface. This is called as the medial border. This extends from the lesser trochanter to the lower end. Last one is the posterior border. This is also called as the linea aspera. The linea aspera is a thick, rough crest in the middle 1/3 of the shaft. Now since this is the crest, it has two lips, a medial lip which is directed medially, and there is a lateral lip which is directed laterally. So a combination of both these lips, the medial lip as well as the lateral lip, will be termed as the linea aspera. The linea aspera is constricted in the middle, like you can see over here, it is constricted in the middle and it is wide open in both the ends. Okay. If we want to see the exact extension of the medial and the lateral lip, first we will see the exact extension of the medial lip. So it is extended from the spiral line over here to the medial supracondylar ridge in the lower portion. Okay, so it is extended like this. Okay, medial supracondylar ridge means it is present in the medial portion. Okay, this is the posterior, that's why I am showing the medial in this direction. Okay, so this is the medial condyle. Okay, so above the condyle, supracondyle. Okay, fine. So this is the medial supracondylar ridge. Okay, this is the ridge. Fine. So the extension of the posterior border is from the spiral line, okay, above to the medial supracondylar ridge below. This is the extension of the medial lip of the posterior border or the linea aspera. Now let's see the lateral lip. It is extended from the gluteal tuberosity above and the lateral supracondylar ridge below. It is similar to the medial supracondylar ridge, but it is present at the lateral surface. Okay. Now the lateral and the medial intramuscular septas. What are intramuscular septas? This is basically a fibrous sheath which is present between two muscles, okay, or a group of muscles. Fine. So it is called as intermuscular septa or intramuscular septa. So the intramuscular septa of the lateral side is attached to the lateral lip of the linea aspera and the intramuscular septa of the medial side is attached to the medial lip of the linea aspera. Here we are talking about the intermuscular septa of the thigh because femur is also called as the thigh bone. Now due to the diversion of the linea aspera, the entire shaft, like the upper 1/3, the middle 1/3 and the lower 1/3, these are divided into various borders and various surfaces. Okay. The upper 1/3 part has 4 borders and 4 surfaces. The borders, namely the medial border, the lateral border, the spiral line, and the lateral lip of the gluteal tuberosity. Then there are 4 surfaces: the anterior surface, the medial surface, the lateral surface, and the posterior surface. This is specific to the upper 1/3 of the shaft of the femur. Now let's talk about the middle 1/3. The middle 1/3 has 3 borders and 3 surfaces. The 3 borders, namely medial border, lateral border, and the posterior border, whereas the 3 surfaces are the anterior border, the medial border, and the lateral border, followed by which there is lower 1/3, which has 4 borders and 4 surfaces. The 4 borders are namely medial border, lateral border, the medial supracondylar ridge or the medial supracondylar line, and then the lateral supracondylar line. Then there are 4 surfaces: the anterior surface, the medial surface, the lateral surface, and the lowermost one is the popliteal surface. I'll share a picture with you of the same so that it becomes easy for you to remember the borders and surfaces of the upper 1/3, middle 1/3, and the lower 1/3 portion of the shaft of the femur. Now let's continue forward. After the upper end and the shaft, let's discuss about the lower end. The lower end of the femur is the lowermost part of the femur, okay, and it articulates with the upper end of the tibia. It primarily contains 2 condyles and an intercondylar fossa. The condyle, which is present at the medial portion or directed medially, will be termed as the medial condyle, and the condyle which is directed towards lateral portion is called as lateral condyle, and the fossa or the area or the depression which is present between the 2 condyles, the medial and the lateral condyle, this area over here will be termed as the intercondylar fossa. Above both the condyles, there are small projections present which are called as epicondyles. These are the small projections, these are called as epicondyles, and these epicondyles, which are small projections above the condyles, if they are present at the medial epicondyle, at the middle condyle, they will be termed as the medial epicondyle, and if they are present above the lateral condyle, it will be termed as lateral epicondyle. Above the medial epicondyle, which is over here, there is a small tubercle or projection present which is called as the adductor tubercle. See, this is the medial epicondyle, and then this is the projection over here which is called as the adductor tubercle. This is a small elevation which lies below and in front of the adductor tubercle. The lower end also has 2 surfaces: the patellar surface, which comes in contact with the patella bone, and then there is a popliteal surface which basically lodges the popliteal fossa. This particular portion over here will be termed as the popliteal surface, okay, because behind the knee joint there is the popliteal fossa. So on the basis of the name of the popliteal fossa, this surface of the femur, the lowermost portion of the femur, will be termed as the popliteal surface. Similarly, there is a patellar surface. Patellar surface covers the anterior surface of both the condyles. See, this is the anterior surface of both the condyles, and the shaded portion over here will be the patellar surface. Covers the anterior surface of both the condyles. This surface is more extended towards the lateral condyle than towards the medial condyle. You can see over here it is more extended towards the lateral condyle, and this surface articulates with the patella. Okay, over here the patella bone will be present. Fine. So it gives the articulating surface towards the patella. So this surface is called as patellar surface. Then there is the tibial surface, which basically covers the inferior and the posterior surface of the 2 condyles. See, below this portion, I'll show you in another diagram. Okay, if you'll see over here, below this surface, there should be the presence of tibia. Okay, so both these condyles will articulate with the tibia's upper end. Okay, fine. So the lowermost portion of the femur bone will be termed as the tibial surface, okay, because it comes in contact with the upper end of the tibia. Now let's discuss about the site determination. The femur's upper end bears a rounded head. You can see over here its upper end bears a rounded head, whereas the lower end is widely expanded. See, the upper end has a rounded head, okay, and the lower end is widely expanded. The head should always be directed medially, okay, it should always be directed medially, and the convex shaft should always be directed forwards, okay. This is a cylindrical shaft which is basically convex, okay, and it should always be directed forwards. Now let's talk about the ossification point. The femur has one primary center and three secondary centers for the upper end. The primary center for the shaft appears in the 7th week of the intrauterine life. It appears in the middle of the shaft. It is shown in the purple color. Then there are three secondary centers. The first one appears for the head. The second one appears over the greater trochanter, and the third one appears for the lesser trochanter. The first one appears at the first ear, then the greater trochanter one appears at roughly about 3 to 5 years, and the center for the lesser trochanter appears round about 12 to 15 years. All these centers then join together to form the upper portion between the 14th to the 18th ear. That is, the three secondary center and the one primary center join together between roughly about 14 to 18 years to form the complete upper portion, followed by which the secondary center for the lower end joins the complete bone to form it at the 20th year, okay, you can see over here. So this was about the ossification. Now let's look at the muscle attachments of the femur bone. I will only tell you few muscle attachments which are easy for you to remember. The rest of you, if you all can remember, then it's fine. If you all can't remember, then just remember these 5-6 muscle attachments. This will be beneficial for you in the examination, okay. Now let's carry forward. Like I've told you, the gluteus maximus muscle takes its insertion from the gluteal tuberosity over here. Then the gluteus minimus muscle, which takes its insertion from the greater trochanter over here. Similarly, the gluteus medius muscle also takes insertion from the greater trochanter or the posterior portion of the greater trochanter over here. After this, there is vastus lateralis muscle, which is placed over here. It takes its origin from the greater trochanter. See, over here, okay, it takes its origin from the greater trochanter. Followed by this, there is vastus intermedius muscle present over here. It takes its origin from the lateral surface of the shaft of the femur. You can see it over here. See, this entire muscle attachment, okay, or the origin of the vastus intermedius muscle, okay, this is happening over the lateral surface of the shaft of the femur. Last one which you can remember will be the vastus medialis muscle. It takes its origin from the medial ridge of the linea aspera or the medial lip of the linea aspera. You can see over here, see, this is the medial lip of the linea aspera, okay. So the vastus medialis muscle is taking origin from the medial lip of the linea aspera. So these were the 6 muscle attachments which you can remember: the gluteus maximus, minimus and medius, as well as the vastus lateralis, vastus medialis and the vastus intermedialis. You can remember this easily because all of these start with the same name roughly, okay, so it becomes easy for you to remember, okay. Now let's talk about the clinical correlation. Like in the other bones, the primary point of clinical anatomy will be the various fractures which happen over the femur bone. You can see over here there are many fractures shown, okay. So the fracture occurs over the lesser trochanter. Then there can be fractures which are occurring over the greater trochanter, then over the head, and the commonest site for fracture will be the neck, the intertrochanteric line. This site, this is the most common site for the fracture of the femur because this is the weakest point. Then there are fractures which happen over the shaft of the femur, okay, where the shaft of the femur breaks, fine. So there is lot of strength required to break the shaft of the femur. So this generally happens in a road traffic accident and or when there is a very severe injury over the thigh, okay. So first fracture which happens over the shaft of the femur is the transverse fracture. Transverse fracture is normally a break or the crack in a straight horizontal line going across the femoral shaft, okay. This is going across the femoral shaft. It is breaking in a straight line, okay. So this is called as a transverse fracture. Next one is an oblique fracture. Now this happens at an angled line across the shaft. See, this is happening at an angled line. This is not going transversely. This is happening at the angled line. So this is called as an oblique fracture because this is going oblique. The fractured line is going oblique, okay. So this is called as an oblique fracture. Next one is a spiral fracture. This fracture normally happens when a twisting force is applied to the thigh which causes this type of fracture. This is the fracture how it looks. This is called as the spiral fracture. Next one is the comminuted fracture, where the shaft or the bone is broken into 3 to 4 pieces or more pieces. To break the shaft of the femur in this way requires lots of force. This is how a comminuted fracture looks like. Then there is an open fracture in which the shaft of the femur bone breaks and it moves out or it comes out of the skin. This is called as an open fracture because it opens the skin and it moves out, doesn't stays inside, okay. So this is called as an open fracture. Then there are fractures which are occurring at the lower end of the femur. This type of fracture, the fracture which is shown over here, generally happens in elderly patients or old patients. This can be due to osteoporosis and other bone related disorders, okay, or in young patients this can be happening in the cases of road traffic accidents, okay. Generally the lower portion of the lower end of the femur gets broken due to the road traffic accident. This type of fractures are a bit difficult to treat because when this type of fracture happens, this generally involves the knee joint as well, okay. So this completes the topic anatomy of femur bone. Thank you so much.